Hello class, let me introduce you to our group. Our group members are Hanane, Clarine, Nelfa, Susan and myself, David. We will be discussing Patricia Benner and Benner's theory from novice to expert. We have come up with a scenario that will help explain the different stages of the theory from novice to expert. This theory is relevant to us as internationally educated nurses as we strive to gain our professionalism in Ontario. We all have experience as clinicians and have been out of the profession for different amounts of time. When we met to discuss our presentation, we all related to the theory and expressed that we all feel like novices again, despite some of us having some quite extensive experience. First, a recap of Patricia Benner. Benner began nursing in the 60s. She worked on acute medical surgical units, critical care units, and also home health care settings. She began her research career in 1970, gaining her doctorate in 1982. Her work set out to study the clinical nursing practice in an attempt to discover and explore the knowledge embedded in the nursing practice. For too long, the profession of nursing has been in the shadow of the medical discipline. Works like Benner's enables nursing as a profession to stand on its own, with their own theories and body of knowledge to back it up. Benner's theory, novice to expert, explains 5 levels of proficiency in nursing, the characteristic of these levels, and how to obtain these levels. So let's have a look at the concepts of the theory. Nursing is a profession and discipline that focuses on the helping role. Benner wanted to explore how we help and how we develop the nursing helping role skills. Nursing also involves teaching and coaching. This involves teaching our patients and also our peers. Benner's theory explored how experience affects the way we teach and coach and the role that we take. Nursing also involves the diagnostic and monitoring of our patients. We diagnose our patients based on the symptoms that we observe, but Benner wanted to explore how we are able to determine what is relevant and irrelevant to our patient's condition, and at what level we are diagnosing and monitoring our patients based on the stages of proficiency. Nursing is a busy discipline. We must manage rapidly changing situations. Benner noticed that nurses who have more experience and are more proficient in the discipline manage the situations differently than to novices. Nurses perform therapeutic tasks in order to improve patients' quality of life. Again, Benner explored how different nurses monitor and implement these interventions. Nursing is a dynamic profession and discipline. Our profession continues to change. Nurses are responsible for ensuring quality health practices are in place and adhered to. Nurses at different stages of proficiency will work in different capacities to ensure this occurs. Finally, a major concept that we can all relate to as novice nurses is organizational and work role competencies. A novice nurse, we use the theory we have learned in school to try and apply it to the practical setting. We may struggle to remain organized and must work extremely hard to reach our role competencies, while an expert nurse has the expertise and experience to stay organized and meet their goals. According to Benner, as our experience grows, our proficiency does as well. The concepts explored give us the 5 fundamentals of the theory. That is, novice, beginner, competent, proficient, and expert. The novice has no professional experience, while the expert has a lot of experience and works on intuition and is able to address the concerns effectively and efficiently. While this slide is a good summary of the fundamentals of the theory, it will be covered in our case scenario that looks at nurses reflecting on the same situation. Let me introduce you to the scenario. Our scenario depicts an elderly woman with dementia. Her dementia is in the early stages and was admitted from a nursing home with a urinary tract infection. She is ambulant with a walker. She is alert to a person. She knows who she is, although she is confused to time and place. She has bouts of aggression and needs redirection. Her family is around a lot, her husband and her 2 adult sons and their families. She has a history of previous falls, recurring urinary tract infections, psychological distress, depression, hypertension, and diabetes mellitus type 2. This is the scenario that each nurse will be reflecting on. Let's see how they reflect on the treatment they provide. Here is Hanane's reflection from the novice nurse's perspective.
Hanane, the novice nurse. I'm a nursing student on the clinical placement doing my internationally educated nurse program at George Brown Hospital. Based on Benner's theory, I have no professional experience. I use my theoretical knowledge base to guide my practice. I am a task-oriented. I have difficulty discerning what is relevant and irrelevant information. This theory applies to the new graduate nurses and student nurses like me. I entered the room and I found my patient extremely agitated. I was unable to assess her vital signs. I have no experience with this scenario. I view my patient's charts and I see the presented medical diagnosis and what I need to do for this shift. I require guidance from my mentor, nurse, but I have an understanding of the theory that I have learned in my nursing program. I have limited experience in this situation and I'm frustrated and anxious about the patient's behavior. I have done my documentation and I need more supervision.
Okay, so Hanane was quite nervous and flustered in treating the patient. Let's see how the beginner nurse handled the same situation.
I am Clarine and I work as a nurse in the acute medical unit at George Brown Hospital. According to Benner, I have some clinical experience and I have marginally acceptable independent performance. I have experience from various clinical situations. I am not completely objective when a situation requires further experiences. My actions are guided by rules and I am oriented by task completion. When I entered the room, I saw the client and she was extremely agitated. I had a limited experience with patients having dementia. Nevertheless, I remained calm when I approached her. I spoke to her and explained the situation. I was able to assess the vital signs. Mrs. X is febrile with a temperature of 38 degrees Celsius. Her blood pressure is clinically high but within normal limits for her. The bladder scan reveals that it has 500 mL post-void and I am seeking advice from my mentor nurse when or not to insert a straight catheter. At 2 o'clock p.m., the next dose of an antibiotic via IV is due and I can prepare and administer the medication myself. After administering my nursing interventions, I document and record my findings.
Okay, great. As you can see, the nurse gains experience, and as they gain this experience, they're becoming more competent. Next, I will be playing the role of the competent nurse.
I am the competent nurse in this situation. I have experience in caring for patients with dementia presenting with UTIs. According to Benner's theory, I am conscious and deliberate in planning. I am selective in assessing important or irrelevant information. I use my critical thinking to decide what to assess in each situation. Consistency, predictability, and time management are important competency performances. Planning is natural and spontaneous. Hyper-responsibility for the patient, sometimes not listening to the patient and think that I know what needs to be done. I still need further coaching and mentoring to move to a professional level of my practice. I entered the room and the patient was extremely agitated. I remained calm and spoke with the patient to explain the situation. I was able to reorientate the patient to the hospital setting. I was then able to assess the vital signs and realise that Mr. X is febrile, 38 degrees Celsius. Blood pressure is clinically high, but within normal limits for this client. At 1400 hours, the next dose of IV antibiotics is due, and I can prepare and administer the medication. The patient has abdominal distension upon palpation and resonant with percussion. The bladder scan reveals that there is 500 mL residual. I understand that a UTI may cause increased confusion and agitation. The patient's bladder is full, and according to the order, I'm going to insert an in-out Foley. At this stage, I'm going to get a midstream urine sample and send it to the laboratory. I see the patient has Tylenol prescribed PRN for fever. As the patient is currently at 30 degrees, I administer the Tylenol. I now document my recordings and findings.
So the competent nurse has more experience than the beginner nurse. The competent nurse is more confident and is starting to show initiative. Next is proficient nurse.
The proficient nurse. I have a lot of experience in a lot of different situations. According to Benner's, I see the client in a holistic manner. I can see the total picture guided by maxims, principles, and protocols. I trust my intuition and have a good grasp of the situation based on background and understanding. I increase my confidence, my knowledge, goals in care of the situation. I involve more the family and the patient. I have reviewed the blood work prior to entering the situation. The family is visiting the client, and I talk to them and then try to encourage Mrs. X to go to the washroom. I educate the family to increase oral fluid intake and explain that the client's confusion has increased. I speak to the nurse manager and request that the client is moved closer to the nursing station due to the increased risk of falls. I request consent from the family member for the use of restraints and side rails if applicable to this situation.
So the proficient nurse has a lot of experience, is confident in their knowledge base, and works holistically with intuition. Now, finally, the expert nurse. Let's see how they reflect on the situation.
I am an expert nurse in this scenario. I am an experienced nurse and I am an expert in my field. According to Benner's theory, I no longer rely on the principles and protocols to connect with the situations and take appropriate actions and interventions. Demonstrate clinical grasp and resources based on my practices. Processing embedded know and how. Setting the big picture from the situations and seeing the unexpected things. When I entered my patient room, I was able to assess the client, and the patient is febrile, is 38 degrees Celsius, and her blood pressure is clinically high but within normal limits for that patient. She has abdominal distension upon palpation and resonant with percussion. The bladder can, it reveals it is 500 ml. And I see the big picture and I am concerned with that the patient has urinary tract infection, may not be reacting to with the current antibiotic therapy. The client was admitted 2 days ago and was started with antibiotic. And if I leave the patient like that, if it is not untreated well, it may result in the further infection such as sepsis. I sent the laboratory for the urine culture and I am waiting for my sensitivity results. Once I get my results, if the patient needs any medication changes, I will advocate for the patient and speak to the physician. And I also mentioned to the physician that the client has febrile and may need blood culture sent for the patient test. And I am a mentor to other nurses. Once I finish all the interventions and I document my findings. Thank you.
So the expert nurse has a lot of experience in varying situations. They're able to mentor less experienced nurses and help grow the profession. We tried to present a scenario that could show how different nurses with different proficiency would handle and address the same situation. As IEN students entering the profession in Ontario, we feel like novices. Some of us have experience from our home countries that we should draw on and help us to move up the novice to expert mountain proficiently. We hope you have enjoyed our presentation. We look forward to your feedback.
Based from the theoretical framework of Benner, we came up with the following nursing care plan, which reflects the quality of skills that nurses are capable to perform. For a novice nurse, nursing care approaches tasks mechanistically, which requires the use of vital signs monitoring equipment to assess the patient. Here is an example of a nursing care plan of a novice nurse. Assessment. Vital signs include BP of 142/90, PR of 90, RR 18, and temperature of 38 degrees Celsius. Nursing diagnosis is hyperthermia related to infection. The nursing goal is to reduce the fever to normal. The intervention includes the following: assess vital signs every 4 hours to monitor changes in the client's vital signs. Administer tepid sponge bath to cool down the patient's body temperature. And administer antipyretic medication such as Tylenol as per Marshit to relieve the fever. The evaluation will be the patient's body temperature goes down to 37.5 degrees Celsius. For a competent nurse, they cope with complex situations through deliberate analysis and planning. A competent nurse will implement a plan of care such as assessment. Vital signs include BP of 142/90, PR of 90, RR is 18, and temperature of 38 degrees Celsius. Bladder is distended upon palpation and resonant with percussion. Bladder scan shows 500 ml of urine. 300 ml of urine was taken via straight catheter. The characteristics of the urine includes cloudy, concentrated, tea-colored, and has foul odor. Culture and sensitivity shows gram-positive bacteria. The nursing diagnosis is urinary tract infection as manifested by the presence of pathogenic microorganisms in the urinary tract. The nursing goal: the client will be free of urinary tract infection as evidenced by the absence of fever and clear non-foul smelling urine. Nursing intervention includes the following: assess the vital signs every 4 hours to monitor changes in the patient's vital signs. Increase client's fluid intake to promote hydration. Promote regular voiding pattern by assisting the patient to the toilet regularly. This is to establish a regular voiding pattern. And administer antibiotic as prescribed by the physician to treat the infection. The evaluation will be the infection was relieved as manifested by clear and non-foul smelling urine and absence of fever and microorganisms in the urinary tract after 7 days of antibiotic treatment. Nurses with more advanced skills are more proficient and has a deeper understanding of situations. Proficient nurses perceive the overall picture and how a patient's action may affect the nursing intervention. Proficient nurses also deals with complex situations holistically. The following care plan reflects the nursing intervention of a proficient nurse. Assessment. Objective data. The patient manifests the following behaviors: confusion, agitation, pulling out the IV line. Nursing diagnosis: risk for injury to self and others. Nursing goal: the patient will be relaxed and adherent to treatment. Intervention includes the following: approach the patient calmly and professionally to ensure that the patient is safe. Reorient the patient to promote self-consciousness. Put the bed in lowest position to promote safety and minimize the risk of falls. Treat the underlying infection. Infection increases delirium and confusion. Evaluation. The patient manifests a more relaxed demeanor adherent to treatment after 7 days of antibiotic therapy.